The second principle looks at stretch sequencing. And what do I mean by that? The ability to create a scenario where you're stretching the muscles more effectively. So, for instance, if I wanted to stretch my hamstring, being the third stretch in diagram one, I would first of all start stretching my gastrocnemius, because what I'm looking at with stretch sequencing is the origin and insertions of the muscles themselves. So if I'm stretching my gastroc, which is stretch number one, I'm indirectly stretching the insertion of the hamstring muscles. Okay, because the hamstring muscles and the gastroc around the knee share a common fascia as well. So if I then relax the gastroc muscle, the next stage that I'm going to go to is I'm not going to start stretching the hamstring muscle. I'm going to go up further up into the glute area, where now I'm going to stretch the glute muscle, the glute piriformis, which is stretch number two. And so, but the reason why you do that is because that's the origin of the hamstring muscle. So when you stretch the origin and the insertion indirectly, then you go into stretching the hamstring muscle, which then becomes a more effective hamstring stretch. So that looks at basically origins and insertions of muscle. The other thing that you look at with principle number two, which is stretch sequencing, is let's say you prescribe a stretch to an individual. In this case, we're looking at the second diagram and it says glute piriformis. And the person's stretching their glute piriformis, but instead of them feeling a stretch in their glute, they're now feeling a sensation anteriorly in their hip flexor area. Okay. So that is telling you that that is the muscle of concern right now. So when you look at this principle, now we sort of say, okay, in order for me to effectively stretch my glute, I need to make sure that I've relaxed my hip flexor muscle. Okay. So that's where, as you see, it goes one. So it goes into the hip flexor. So now when I'm stretching my hip flexor muscle and that's relaxed, again, following the principles of microstretching, which is 3 times per muscle group, okay, of 60 seconds. Then when I go back and stretch my glute muscle, I have relaxed the hip flexor, which then allows me to continue stretching the rest of the sequence that I've prescribed in this protocol for a person. Okay.
Well, yeah, absolutely. Can we apply these principles, and is there any difference? I mean, can we do this with patients with suffering from knee arthrofibrosis? In the end, it's not a healthy joint, and also there are a lot of structures that are fused together: tendons, muscle, capsule. There are scarred, there's adhesions, and as we said, scar tissues. How does this apply to these knees and these patients?
Most certainly, you can apply microstretching, because, as I have reiterated before, with microstretching, the stretch is very, very gentle, aimed at minimizing any pain in order to ameliorate inflammation and inflammatory response. And as indicated, as to what we've shown or further up with regards to, as you can see, I still have this diagram here with the people, they're supported. It's again, if you're supporting your body and the stretch is very, very gentle, around a 3 or 4 out of 10, that is less likely to cause more pain in the arthrofibrotic joint itself, as well as you're relaxing the supportive structures of the joint as well, the ligaments, the tendons, and the muscles. So when all those are relaxed, again, you're the expert in this disease, not me. But from working with my athletes, I've realized that when I relax all the supportive structures around the joint, that the joint actually is less compressed. And compression, I think, is something that we look at, because this is something that we're all exposed to when we walk and stuff like. So if you've got a very, very tight joint, you've got compression in that joint. And how does that affect the cartilage and the cartilage cells? So if you release that compression in that joint by relaxing all the other muscles, you're more likely to help that joint heal. Yeah.
Yeah. In this, maybe we can introduce if there is any active versus passive component in stretching. So the question would be, is this all passive stretching, active stretching, and or what is that, let's say, between the two, if there is any difference, what is that you think is mostly helpful? So is it better to perform passive stretching with help of another person maybe, or actively performing it, the patient himself or herself?
Okay, very, very good question. And first and foremost, I want to make a distinction between active stretching and passive stretching. So, in the first diagram, the person is doing an active stretch. So, basically, they are stretching themselves. So, it's performed by them. And in this particular stretch, the person is stretching their right glute piriformis muscle. But as you can see, the body that the individual is lying flat on their back. They actually have a pillow underneath their head because that way it forces the back, the diminishes the lordotic curve in the lower back, which then relaxes the lower back, and they have their feet up against the wall, so that way they've got more control when they're doing the stretch in their glute piriformis. That is an active stretch. Now, with a passive stretch, what we're referring to is, as you touched upon, partner assisted stretching. Okay. It could either be another person who is going through the same issues with with the patient, and the therapists have taught them how to stretch. How do you say, passively, being assistant stretching, or it could even be an implement. I know that some people like Kaylee uses continuous passive motion, which is a mechanical machine that basically does the stretching for you. So, in a nutshell, with passive stretching, you are allowing somebody or some machine to do the work for you. Okay. And in this particular case, I'm stretching this individual and I am passively, so this is that photograph B, I am passively stretching that person's right hamstring. As you can see, the leg is supported, which then means the person is less likely to create any contraction in their body in order to sometimes, as you will know as a therapist, patients want to help you and you say to them, please relax, but, and they don't. It's a very, very hard thing. It seems like it's hardwired into the nervous system that if somebody is working on me, I've got to actually get involved. Okay. Now, this segues into your other question as to which is better. So, my belief is that they're both equally important. Besides being treated passively, patients need to have an active role in their therapy, because then they become part of, how do you say, the process of trying to help themselves get better. And again, as presented above, and in my belief is that, again, it needs to be supported when they're doing the stretches. Okay. And this allows for more control since the tension in the muscle is minimized and the patient has a better feel for their body. But more importantly, they're becoming part of what you're trying to accomplish with them. So I just think they're equally important. And by working with you, Sebastiano, and you educating your patients, you're also giving them that information that they need in order for them to take it to the next level with regards to what they need to do to help themselves.
Good point, actually. We need to involve patients actively, but also, yeah, I do agree. As a physical therapist, uh, aside of the fact that knee arthrofibrosis is a complex pathology and they have to deal with this for a while, which is stressful and etc., frustrating, that's probably the point number one to start the whole process in which you said, listen, we need your help, we need your participation. This is your knee. It's complex. We are not going to win this battle just because I do something useful. Also, you need part of the process, and you kind of touched upon this before, it is also a matter of continuity, so frequency, how often you do these things also at home. It cannot just be done in a single session in physio. So we need you, otherwise we will most probably fail. It's just a matter of spreading the volume throughout the day and making sure that it's not too much all of a sudden, but little and often, which is the way we frame this out, which is very nice to listening to you talking about, because I was thinking about, we always say to patients, little and often, not too much of an insult. We just need to convince your tissues to give up
Oh,
progressively.
exactly. And I often say to the patients that I've worked with, I'm in the business of being out of business.
Yeah, I agree.
Basically, what I'm trying to do is I'm trying to give you the tools for you to heal yourself. And eventually, you'll get to that point and you can probably come back for a minor adjustment. But you need to actively be involved with this. You know,
Yeah, I wasn't expecting to touch to cover this, but this is interesting because it's also intimately related to I would say doing a better job as physical therapists in general. Also athletic trainers, they are also helping people with, more temporary maybe issues. But yeah, in the end, it's education and helping them throughout the process. Let me say that in the end, if we wanna to move on to my next question, if we wanna educate them, we need to be effective in the communication. And the problem we have with these patients, with all the patients, it is sometimes we think too much in scales. We say to patient, listen, you should tolerate pain, or in this case, I would say stretch intensity 3 out of 10, 4 out of 10. And some of the patients you work with, you have a better relationship with, sometimes they just turn, look at you and said, I have no idea what you're talking about. What does it mean? It's just numbers. So can you sort of frame better this? How can we
sure.
communicate more effectively to patients what is the stretching sensation they should tolerate or go through to perform useful stretching for them with arthrofibrosis, for instance?
For we've already touched upon this earlier on when I basically said that the stretch needs to feel like putting your hand in lukewarm water. It's that nice, this feels really gentle, really warm. That's the thing. But I could also give you a visual with regards to what I refer to as proper stretching intensity. If we place our elbow on the table this way, and then we allow our hand to basically flop or fall down this like this, okay? If I do this aggressively, I'm going to feel a lot of tension in my wrist. Okay. So, because I am now picking up discomfort and pain, and that's way too much. So, what is microstretching? What is a very, very gentle form of stretching? If you just allow the wrist to flop this way, all it is just where you start seeing just that gentle movement, that's the stretching intensity right there. And it's a nice, gentle feeling. It's a nice, how do you say, low pull. That's the key. So again, if I do this, if this is where my wrist naturally stops, just when I put little pressure and I start seeing that movement, that's what I call proper stretch intensity. And I hope that gives them a visual as well, you know. But
Very,
I know I agree with you. You can say that to a lot of people, you know. But again, the most important thing, and we're touching upon this again as therapists, is as we're educating, we need to take our patients and physically get them into that position that you are trying to teach them as an active stretch and get them to experiment as well. So if they're doing a stretch and all of a sudden they're feeling a lot of tension building up in there and they're feeling discomfort and pain, from my point of view, because we're talking about microstretching, which is very gentle, I will say to them, back off a lot, and make sure that your body is properly supported. So that's the key for me, is not only are you doing the therapy on them, but when you teach them the homework, get them to experiment in front of you. And then the light bulb is going to go off. Okay.
Perfect. That's quite clear. Let me ask you one more thing. Let's expand this because this happens, I believe, to all of us in your experience. Sometimes we have overachievers. We have
Oh,
patients, they're athletes and they don't see the point in doing something that is as you described. And this is, I think, with something we face every day. So, any additional suggestion for, help? In the end, we want to help the patients, right? So you will brilliantly explain later why we could harm patients with an excessive stretching. But in the end, the point is anything different you would say to help them out, because sometimes let's say the regular people, they could get this what you just frame out. But what if we have someone that says, I think it's for me, this is good, this is better, and they keep doing something that might be too much for them. Just wording wise, I mean, as a therapist, what is your experience in trying to convince them, the overachievers, in doing the right thing?
well, if they're paid athletes, you can say to them, listen, if you want to continue making your multi-million dollars, you better, do something different. And it's the same thing with the athletes. If the athlete is still continuing, for instance, I've worked a lot with Muay Thai and Taekwondo, and I actually looked at what they do, and it's excessive stretching. Like, I mean, what they do with regards to their bodies is something else. But a lot of these athletes that have come to me from even mixed martial arts, the first thing that they've noticed is when they actually get injured, they lose that range of motion. And then all of a sudden they're contemplating, hey, I used to be able to do the splits. Now I can't do the splits anymore. And that's because a lot of that tissue was built up through scar tissue, as we talked about earlier on. It was laid down quickly. So you say to the athlete then, and I've worked, like I said, I've had athletes like this where I said, now let's take a different approach. You've done your approach for so many years and you've injured and you've lost that range of motion. Now let's look at another approach where we're going to be very gentle and we're going to gain back that range of motion. But more importantly, it's something that you don't have to put yourself through pain and discomfort. Because when you do that, and we're going to talk about this later on, it's a sympathetic nervous system response. So you're doing something where you're cognitively, how do you say, blocking it out because you have believed that if I stretch aggressively to the point of pain, that means I'm going to get better and I'm going to get that range of motion that I want. No, you're not. What you're doing is you're fighting your nervous system because your nervous system has been designed to sense pain and know pain. So when it senses pain, it becomes activated, the sympathetic nervous system, which then means there's more tension in your body right now. And what is the purpose of the sympathetic nervous system? To protect you. It's a stimulus that says, hold on, this is way too much. And if you continue, you are going to get injured. So I'm going to try to prevent you from doing that. So the classic example I say with a lot of my athletes is you take your hand and you put it on a hot element, a stove. Are you going to leave it there? Of course not, because your body's saying, wait a second, if this continues, I'm going to have my hand for dinner because it's going to be all charred and scarred and whatever. So you remove it. The body's no different. When you're stretching the body knows pain, no pain, discomfort, no discomfort. So with a lot of these athletes, you've used a method that's gotten you to a point where you're doing quite well or have done well, but now you're injured. Now let's look at something different.
Yeah, this beautifully links to the concept of noxious stimuli in the end, which is what we try to explain to patients. But that's another topic, but very
We
interesting.
can go on and on and
Yeah,
on.
exactly. Thank you for going through this. It was, I think, important because physios sometimes we struggle with different categories of patients, and the overachievers, the athletes, in the end, especially when they get injured in a way that is handicapping them this much, like arthrofibrosis, they try to do more and more and more. They need to make it happen, and this is very frustrating for them. So having effective strategies also to explain this, what we are trying to do to them, it
Well, we
is,
always,
I believe, important.
I think the most important thing, Sebastiano, is less is more.
Yeah.
Less is more. As you said, bits by bit, by bit by bit, you know.
Okay, so let me go ahead if it's okay for you with, let's say, can you please explain to us what is that you found, that you discovered throughout your research, the studies you conducted, specifically about the effect of the different level of stretching, and in the end, stretch intensity? What happens if we overstretch or if we stretch with an excess of intensity?
Well, that's a good question. And that brings us back to my thesis. So, as you introduced us earlier, introduced me about my book, Stretch Intense and the Inflammatory Response. That was my specific topic. I always, how do you say, always believed that it's the intensity that we need to look at. So, uh, so I was able to, with my doctoral research studies, examine the issue that had troubled me for many years. Critically, the results confirmed in me that stretching needs to be done gently. Okay. So if one forces a stretch to the point of pain and discomfort, I wanted to say or see conclusively, does this cause inflammation or not? Okay. So with this diagram over here that you see, again, we're bringing in the cells and the how do you say, the pro-inflammatory cytokines, the proteins. What I specifically looked at with my work is the very first study asked the question, acute inflammation response to stretching. So what we looked at was, what effect does aggressive stretching have? So in this case, we defined aggressive stretching as an 8 out of 10. So on this scale, as you see here, high intensity stretching, great pain, high awareness of muscle pull. Okay. And what we looked at was this thing down here called HSCRP, which basically means C-reactive protein. And C-reactive protein is very, very important because anytime you cause an injury locally, the body basically looks at trying to heal what's happening locally, but at the same time, it releases this thing called another pro-inflammatory cytokine called IL-6, interleukin 6. Interleukin 6 is very, very important because for it to be, how do you say, expressed, you have to work with what we initially talked about was with tumor necrosis factor alpha and interleukin 1 beta. These are released at the site. So what we looked at was, if we stretch aggressively, can this cause inflammation? And what we measured was high sensitivity C-reactive protein. And we found that within immediately post-aggressive stretching, so we actually had a therapist aggressively stretch the glutes, the hamstrings, and the hip flexors of the participants themselves. And we specifically did what we call a randomized crossover trial, which basically means that the participants became their control. Okay. And what we found is with aggressive stretching, and again, we compared aggressive stretching and no stretching at this point. Okay. And what we found is that with aggressive stretching, there was an increase in HSCRP immediately post and 24 hours post. I'd like to sort of mention that my studies were the first studies in the world to look at human subjects stretching, doing stretching, blood biomarkers. And we wanted to basically measure inflammation, which they've never done before. So then we conclusively showed that with the first study, we do get an increase in HSCRP, which then means that the body has inflammation in it with aggressive stretching. Now, the second study looked at specifically stretch intensity versus inflammation. Is there a dose-dependent association? Basically meaning, if I'm stretching at 30%, if I'm stretching at 60%, or if I'm stretching at 90% of a maximum perceived stretch, am I going to get an inflammatory response, and how much? So with this particular study, again, we had a randomized crossover trial, and we specifically looked at HSCRP again, because in order for HSCRP to express, as I said earlier on, IL-6 needs to be expressed. And in order for that to get expressed, tumor necrosis factor alpha and IL-1 beta have to be expressed locally. Okay. So, and what we found is that we had all our subjects and we got them, we were looking at the hamstring muscles. And what we observed is that if they're stretching at an intensity of 9 out of 10, which is high intensity stretch, we saw inflammation. Okay. However, when we compared a 6 out of 10 and a 3 out of 10, which is where microstretching is, 3 or 4 out of 10, we didn't see any inflammation present. So the thing was that, again, it would be really great to go in there and do another study which specifically homes in on just 3 or 4 out of 10. But what we noticed is that as we progress from a 30% stretch to a 90% stretch, both immediately post and 24 hours post, we saw that we were more likely to see an increase in inflammation in the body.
Yeah, and if I may ask to possibly expand this, when you say stretching to 3 out of 10, 6 out of 10, 9 out of 10, you mentioned intensity, but let's talk about pain again. If we say to patients, use the pain scale. So if they get it, if that's making sense for them, don't do anything above 6 out of 10, for instance. Otherwise, you would increase inflammation and potentially hurt yourself. Is pain a good indicator for excessive stretching intensity, or is it something different and somehow?
That's a good question, because I tend not to use a pain scale, because if I say to somebody, I want you to stretch a 3 or 4 out of 10 on a pain scale, they're going to be thinking to themselves, I need to feel some pain, because otherwise I'm not doing anything. So I tend to use tension. Okay. But that's a good question, because pain is a very, very important thing. And that will lead us into this diagram here. According to the International Association for the Study of Pain, it's an unpleasant sensory emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Therefore, the development of excessive mechanical force during stretching causing pain is more likely to increase the potential of increase and sustained tissue damage. So basically, as we previously discussed, excessive force in the form of stretching causes inflammation. That's what I saw through my research. And associated with, as we said, the pro-inflammatory cytokines and the immune response. However, when we consider pain as a good indicator of excessive force, I think what's very, very important is, as therapists, we observe the individual's response to, in particular, their physical reaction. Because if I'm sitting there stretching somebody, and when I stretch my patient, Sebastiano, I look at their gut, because the enteric system is so involved with the sympathetic nervous system that as I'm stretching them, if I see them flinching in their stomach, I may have gone way too far. I may have touched pain. So again, pain, if you activate pain, you activate the sympathetic nervous system with the whole, response for the SNS is to basically limit the stimulus of pain. And the other thing that you can use with your patients and your athletes is the whole idea behind the sympathetic nervous system is it basically looks at stimulating what we call the fight, flight, or fright. The whole idea is to remove yourself from that stimulus to protect yourself. So pain and excessive force, if you're seeing physically, the person is generating that pain, you can bet your bottom dollar that you're activating the sympathetic nervous system. And then the whole system is trying to basically deal with removing itself from that stimulus. But more importantly, it's been shown that the sympathetic nervous system is related to inflammation and the inflammatory response, which then becomes your main thing is to try to ameliorate as much inflammation in there as possible.
Yeah, thank you. So let's say in the end, to close this up, out of your experience and research, what is the most effective method of stretching that you would recommend? You kind of described this already, but as a final message.
I'm going to be biased.
As we all are.
As we all are. Again, I've been involved with the use of stretching for 4 decades. Specifically, how do you say, I developed internationally, and this has been documented in newspapers and stuff, is that I developed the whole concept of stretch therapy and now microstretching, basically looking at stretching and using it from a therapeutic point of view to deal with inflammation and inflammatory response. So I did everything ass backwards. Sorry for the word ass, but I basically developed microstretching in my early 30s. No, actually my mid 20s. I'm 64 now. And I didn't have research. I just had a gut feeling that what we're doing, for my observation, was wrong. I was seeing back then, PNF stretching was really, really used a lot. Proprioceptive neuromuscular facilitation. And trainers were using it as well. And they were putting their clients or even patients through excessive pain. And you can see these people, they were grimacing as the other person's telling them, push against me, and stuff like this. And I'm thinking to myself, something's not right here. So I started looking at, hey, why don't we stretch gently and support the body? And 30 years later, in 2012, I was told by a lot of sports medicine doctors that I worked with in Canada, you need to do your Ph.D. So I did my Ph.D. after I developed all this anecdotal stuff. So based on my work and my observations, I found that gentle stretching is the most preferred method of stretching. However, having said that, I also think what's very, very important is the activation of the sympathetic nervous system and inflammation. So you have to try to diminish activating that SNS in order to be able to help the body heal properly and recover and regenerate. So
thank you. That was very informing. And yeah, in the end, we appreciate the fact that you spent the time with us, first of all, and but also to share this knowledge and try to discuss about the concept of stretching intensity and what we can cause at the tissue level, but in general, throughout stretching at different intensities. So again, thank you very much for being with us. This interview will be on the IAA YouTube channel, available freely to whoever wants to go through it. And this is what we try to do with IAA. We try to put up there evidence-based, or at least I would say evidence-informed content, because we are all biased. There are limitations, and many studies should be still conducted. But at least now we have good content, quality content on stretching intensity, and how we can possibly influence also scarring tissues in joints, like in patients with arthrofibrosis. So Nikos, thank you very much. It was really appreciated from us being your availability to be with us.
Sebastiano, I am honored to be able to share my knowledge and give my information to yourself and to all your arthrofibrotic patients and researchers.
Thanks again, and thank you everybody for watching, and and have a good day.